I found that when I'm interviewing candidates, I need to interview them and they need to interview me equally, especially if it's a really good candidate. I expect that even if they tell me they don't have other offers, they likely have other offers and are pursuing the same type of job in other places. So I need to sell them on the institution. I talk to them about all the benefits we have, such as the tuition reimbursement, the ability to attend conferences, be involved in shared governance, and really sell the magnet as well. That's a big selling point for people that have done their research. It shows a lot about our hospital. So I try to sell them on us. Then I also sell them as myself as a leader. What am I going to offer them? What kind of benefits can I help them grow, mentor, encourage them? You know, if it's somebody that is a non-nurse, how do we engage them into possibly getting into nursing school if that's something that's in their long-term plan? Also as the nurses as well, like talking to them about the promotion of the different programs we have, the clinical ladder, which will soon become the clinical excellence program, and that there's a lot of opportunities here, even for growth beyond nursing if they want to move into management or into education and things like that. So I found that those things are really important. And then once I do all of that, I ask them for a commitment. I kind of tell them what we're going to do for them and make them feel like a valued member of our team. And then I ask them for what they can do for us and how can we have a good relationship together and possibly encourage them to have their career here at Virginia Hospital Center. So I usually like to ask for a 2-year commitment. And what I tell them is it's going to take you a good 6 to 9 months to feel comfortable here. So really, you're just coming in, trying to figure out how to do your job on a daily basis. That 9 months to 1 year, you're starting to feel a little bit comfortable. You don't have the butterflies in your stomach every day when you come in. But that next year is going to be really all about them growing, possibly getting involved in other committees and things that they were not ready to get involved in first. So in order to really feel like you have learned and are able to help others, you need about a 2-year commitment. So I asked them, I explained to them just what I told you, how the process is going to be, and I say, are you comfortable giving me a 2-year commitment? We're going to invest in you. We're going to put a lot of effort into your orientation. We're going to mentor you. As your PCD, I'm going to sit down with you weekly and we're going to talk about how things are going. So we're going to do all of this for you. Could you commit to us for 2 years? Because I explained to them, it's really dissatisfying to the staff when we hire somebody and then they leave in 6 or 9 months. So this is a good way that you know what you're getting out of us and we can depend on getting something out of you. So people are actually very appreciative. I think we all like to know what is expected of us and what we can expect from other people. So by putting myself out there first and telling them what I'm going to offer them and what they can expect from me as their leader, they don't have a problem then committing to an expectation that I'm asking from them. I think it goes 2 ways. And they've all said, everyone I've always asked has said, sure, that sounds reasonable. It makes sense what you're saying, that it's going to take me a while to get comfortable. And everyone I've ever asked for that 2-year commitment has given it to me. And it's actually something that the staff remember because they will bring it up. I actually had a person in my office this morning say, I told you I'd give you 2 years and here I am 3-4 years later. And it's true, you know, when we commit to something, most people are generally going to follow up with it. And I think it gives them structure. They know what is expected of them, and that is to stay put and grow in their role in their own department for 2 years. And of course, I offer them that if in the future they want to grow and move on, we're happy to promote that within the hospital. There's a lot of opportunities. But to really be successful, you need to dedicate at least 2 years to the department that you start on. So I like to set expectations so that they know what they're getting into, and I don't have to say to them 2 months into the job, you're not coming to work on time. So I put it out there from the beginning. I ask for basic things and I tell them these are basic things that I hope you would want to see in your colleagues as well. I ask them to actually come to work. You're going to have an opportunity to be part of your scheduling. We're going to give you your schedule a few weeks, months in advance, but I need you to commit to that. I need you to actually come to work on the days that you're scheduled to come to work. It seems like a basic thing, but you'd be surprised how many people, again, if this is your first job out of college, maybe you're used to not having that kind of a commitment. But I say to them, the team depends on you to be here. So when you're not here, you know what it's like to work short-staffed. Imagine if you're the one that calls that being short-staffed. So I ask them to come to work. I ask them to be on time, right? Nobody wants staff rolling in at 7:05, 7:10. In some departments, sometimes the patients are waiting for you before the staff even get there, and that doesn't look good. So I ask them to be on time, do whatever they need to do to come in and get ready for their day. I ask them to be a team player. And in my departments, I don't allow them to use the phrase, that's not my job. And I set that standard from the beginning. We're all here to help. We're all team players. We work together. So you need to not have that attitude. Obviously, if it's something without your scope, you just say, I'm going to go find somebody that can help you with that. But we really need everyone to have that can-do teamwork attitude. And the last thing I do is I talk about drama, because most people don't like drama, but they can get sucked into it. So I say, you know what? We don't want drama in this department. We don't allow it. We all have baggage, we all have families, we all have things that happen outside of work, but we need you to check those issues at the door. And when you come in, you need to be the best version of yourself. And it's because everyone that we're dealing with, whether it be inpatient or outpatient, they've got something worse going on than us, because they're either in the hospital or they're at a doctor's appointment, and we're not. So we need to be sensitive to that. So if you need to talk about personal issues, do that in the break room, do that outside of work with your colleagues, but let's just keep work when we're here. And that's gonna portray in the way that we provide care for our patients. So they're very basic things, but I find that when I have these conversations with people, they tell me, no one's ever mentioned this in a job interview. And I'm really showing them a little bit about myself, right? How I hold my team accountable. Because if I'm telling them that during the interview process, it's probably pretty obvious that the rest of the team out there is used to handling those expectations. And most people like that stuff. They want to come in, they want to do their job, they want to feel like they're contributing, and they don't want to deal with people not showing up and no drama. So I've gotten very good reception from that. And again, I think that just strengthens the relationship. I show them a little bit of my cards, I ask them to show me their cards, and we have a really good working relationship.